Welcome back, everybody. We are continuing our coverage, special coverage of the COVID-19 outbreak and the coronavirus. We have local health authorities right here with us in studio. We're going to ask them questions, and you can ask them questions.
Right. We have communicable disease expert Kim Toevs and Dr. Steve Krager. They are here and they are ready to go. Thank you so much for your patience as we listened into a news conference here to start the 4 o'clock hour. Let's start with sort of what they wanted to hammer home, you guys, in that news conference, where they really wanted to say, we don't want to do necessarily a lockdown here in the city and the county and maybe even further out. What was the point, you two, do you think, of that news conference? What did they really want to hammer home?
I think that they wanted to hammer home that we want to work collaboratively and collectively as government with our business partners, with individuals, with community organizations, that there's a lot of goodwill on everyone's part, and we haven't really gotten the most yet. It's just been a few days that we've had our social distancing policy directive from the governor, and that there's more that we can do to make the most of that before we need to get into something that has more of a enforcement or regulatory energy to it.
Right, really a voluntary approach here. Let's all take some personal responsibility and really practice this social distancing before any sort of enforcement has to come into place, because that sounds like something they just don't want to do right now. This is really on us right now.
There's no easy way to ask this. Is this political cover for the governor and for the mayor, who have to make the tough choices, that if you folks as health professionals say we don't need shelter in place, therefore you don't need to order it?
I think there are a lot of policy directives that the governor and that the mayor of Portland, as well as our county chair, are working on. Those can be anything from helping support emergency childcare for first responders and healthcare providers. There's a lot of work that they're doing for eviction moratorium, as well as to financially support small businesses. There's a lot of work for us to focus on to get healthcare to stand up extra acute care beds, and to help all of us support our neighbors who are in the most vulnerable populations, that we're really asking to be very careful and stay inside, make sure that they don't feel socially isolated, that they have food delivered to them. So there's a whole lot of stuff we can do that will take our focus and our attention, both policy as well as individual action, and that should be our focus right now.
I think one thing we're seeing a lot of too is we've just had some really beautiful weather. Folks have kids home as well, and they want to go outside and they want to play. But should we be gathering at parks? Should we be hiking in groups? Can you guys comment on that?
Sure. I mean, the phrase shelter in place is more used when the air is toxic from an environmental contaminant, et cetera, and that implies that you should be inside with the door shut, with the windows shut. That's not how this disease is spread. It's spread by the close contact in between people who are a few feet apart. So if you're able to be outside in the spring, get exercise. That's really important for people's physical health. It's important for people's mental health. This is not going to be a 2-week event for us. This event is going to last a number of months, and so we need to all sort of look to the long game together. What's going to help us keep our sanity, keep our kids' sanity. I wouldn't put kids in close groups together, mixing and matching, but if you want to put your kids outside on bicycles, you want to take a hike in a park, I do really recommend folks stay 6 feet away from each other, which means don't carpool together. But there are ways people can enjoy activity outside and have that distance that will keep folks safe.
I think it's been fun to kind of see people's response to some of this. They've been trying to have fun with it. They've been really going all out. A few of the examples I've seen, but I have said to your point, Kim, that we need to buckle up here and kind of slow down a little, because this is going to have to spread out over quite a long time. So to sort of use all of those activities wisely, right?
Absolutely. I think we do need to look at this as a long-term issue and kind of come to grips with that. We want people to be healthy, and that includes their physical health, absolutely, but also their mental health. So that's why we're talking about these things you can do to care for yourself, things you can do to stay connected with people, with friends, with family, that don't involve, actually physically being close to people. We have great technology, we have phones, we have cameras that allow us to communicate these days, and we should use those to the best of our abilities.
We have a lot of questions. I have a lot of questions. People at home have a lot of questions. We're going to take a short break. When we come back, we'll have a lot of those questions. Go to Facebook right now, and you can send in your question for us. We'll be right back.